Is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Lisa White, CML's Membership Services Manager, and it is a pleasure to have you here today for this very, very important webinar on brain injury in our community, the prevalence, pressures, and problem solving. With me today, I have Liz Gerdman, Director of Professional Programs for the Brain Injury Alliance of Colorado, and Judy Detmer, Director of MINDSOURCE, Brain Injury Network, Office of Community Access and Independence at the Colorado Department of Human Services. You are in very, very good hands today. All of you will be muted for the webinar. If you're not familiar with the webinar format, you will see a control panel to the top right of the screen. You have an orange arrow to the left of the panel, which will minimize that entire box. We are muting you, but we ask that you type in questions at the end into the question box on the control panel. All the questions will be answered at the end of the webinar. We are recording this webinar, so please keep in mind if you missed something or if you wanted to perhaps share this webinar with a colleague who wasn't able to join you today, you'll be able to send the link directly to them. It won't be password protected or anything like that, so you'll be able to share this information far and wide to your colleagues. I will let you know that if you're an elected official and you registered, you will receive 1 university training credit by participating, so thank you for that. That'll be added to your account, and you can always check on your credits at cml.org under training. At this time, I am going to turn it over to Liz and Judy. Again, thank you for joining us.
Great, thank you so much. So again, my name is Liz Gerdman, and I'm with the Brain Injury Alliance of Colorado.
Sure, I'm Judy Detmer and with MINDSOURCE Brain Injury Network. We're excited to have the opportunity to do this presentation with you all, and just know we're available as resources far beyond this webinar.
So our objectives for this webinar are to give you guys a little bit more information about brain injury, terminology, prevalence, needs and challenges faced by individuals in our state with brain injury, and help you better understand the existing infrastructure and efforts that are going on to support these individuals so that you can recognize these systems in your communities. We also have a video on some strategies and accommodations to support people with brain injuries. I'm not sure if we'll show that due to time, but we can, those are available on our website and are really helpful for anybody who might be interacting with people with brain injuries. So when we say brain injury, we are referring to what's called acquired brain injury. A lot of people hear TBI in the news and the media and jump straight to that, but TBI is a subset of a larger category, is a category of a larger terminology called acquired brain injury. So acquired meaning something that's happened to your brain after birth that's not degenerative. So this can be an external force to the head, such as falls, motor vehicle accidents, blast injuries, but it can also be what's called a non-traumatic brain injury, an internal event, such as a stroke or an infection. This is important to know because a lot of people think that the only way to sustain a brain injury is a traumatic brain injury, but there are a lot of individuals that we work with who have suffered anoxia, for example, which is lack of oxygen to the brain, and both TBIs and non-traumatic brain injuries have similar consequences, similar symptoms, and therefore services and programs that are administered to these individuals can be similar. So we work with the whole spectrum. This is a little bit more about mechanism of injury. For those of you who haven't had biology in a while, your brain is very fragile and there are lots of different ways that it can be injured. We're really trying to promote more awareness in the community that a stroke is a brain injury. So a lot of hospitals are now connecting people with stroke to our organization, which is great, and we're providing them with services and supports. Youth are a vulnerable population. A lot of people used to think that kids had more resilience, and because they had more time to develop and recover from an injury, but what we're learning is that's not exactly the case. A lot of kids haven't even developed skills yet, whereas adults, their brains have already been developed. And so when they have an injury, they can fall back on other skills. So we're seeing a lot of challenges with youth who are sustaining brain injuries. The brain isn't even fully developed until your early to mid 20s. And so if that development is interrupted, we see challenges long term. The frontal lobe is responsible for some really important skills, such as executive functions like thinking, planning, organizing, controlling your behavior. But this is also very vulnerable to injury. If you think about falls, assaults, motor vehicle accidents, a lot of the time it's the front of your head. And this is also the last part of your brain to develop. So it's a really important part of your brain and very vulnerable to injury. You may hear people talk about their mild TBI or moderate TBI, and this is what they're referring to. Doctors will use things like how an individual responds to stimuli immediately following the injury, if they're experiencing amnesia, but kind of a simple way to classify severity is if somebody lost consciousness, and if so, for how long. And this is specific to traumatic brain injury. So you may hear somebody say, I had a really severe concussion, but a concussion is very different than a severe TBI. Concussion and mild TBI are the same thing. And while somebody may have experienced a lot of symptoms that were severe due to their concussion, a severe TBI is losing consciousness for over a day, so basically a coma. The majority of brain injuries that occur are in this mild category. So some of those more moderate to severe injuries will end up in rehab hospitals such as Craig Hospital, for example. You don't have to lose consciousness to be diagnosed with a brain injury. A lot of people used to think that. That was a misconception out there. But you can be unconscious for half an hour and it's still classified as mild, which is frustrating for a lot of the people we work with because they would not describe their symptoms as mild. They would not describe their challenges as mild. So these are really just about the medical terminology. Symptoms are typically classified into these four areas: thinking, physical symptoms, emotional, and then sleep. A lot of our clients feel like they're in a fog, just struggle with concentrating, retaining new information. Some of the physical symptoms that we see long-term are things like headaches, sensitivity to light, noise, balance issues. There are emotional struggles after brain injury. Sometimes there are mental health challenges, but also just having, a shorter fuse and challenges with regulating emotions. And then sleep is often one of those things that's affected by brain injury, either needing more sleep than previously or struggling with falling asleep and staying asleep. I mentioned this before, but the majority of brain injuries that occur are in this mild category. It's challenging though because sometimes the symptoms don't show up right away, and it can also mirror other disabilities. So we have a number of clients who've been misdiagnosed with bipolar disorder, for example, when they actually sustained a concussion. I mentioned also that the majority are not associated with loss of consciousness. They don't always show up on imaging like CAT scans or MRIs, and a lot of people don't seek medical treatment for concussions. And that's for a number of different reasons. Sometimes it's because they don't think it's that bad and they think they'll be okay, or maybe they're doing something illegal at the time, or they're intoxicated at the time, or it's a domestic violence situation. There are a lot of different reasons why people don't seek medical treatment. Individuals who sustain one concussion are at an increased risk of sustaining more. And that's because brain injury can impair things like balance, as well as judgment and decision making. So some statistics for you guys to understand kind of what it looks like across the United States. We see peaks at different age groups, the 0 to 4 range. A lot of brain injuries at that age range are due to child abuse, such as like shaken baby. 15 to 19-year-olds are getting into car accidents and either being the driver or a passenger in another young driver's car, which is why we're seeing, more laws around teenagers not being able to drive together. And then 65 and over, the majority of TBIs for that age range are falls. Falls are the leading cause in the United States. This number down at the bottom, though, the 2.8 million, I just want to caution, that comes from the CDC, and the way that they count brain injuries is if you've been admitted to a hospital. So if you had a concussion or any severity of brain injury and didn't seek medical treatment, or maybe you went to urgent care, or you went to the emergency room and were released, or you sought treatment from your primary care physician a couple days later because of symptoms, you're not being counted in that number. So we think it's probably closer to 10 million. In Colorado, Craig Hospital did a really interesting study recently where they randomly called almost 3,000 people and administered a phone screen with them and asked them about injuries they've had in their lifetime, different diagnoses they've had, if any of those injuries involved their head or neck, things like that. 1 in 4 Coloradans reported sustaining a brain injury at some point in their life that included a loss of consciousness. So that was a lot higher than we ever expected. They only asked adults, and they only asked them about those traumatic brain injuries, the external forces to the head. So we know we're missing even more people with youth and stroke numbers and things like that. So we kind of use this 500,000 number because those are individuals who are also living with a disability and would likely need our support or support from the state. With respect to these other bullet points, we're kind of on par with the rest of the country demographically, but we're up there. We're up there. We have a very active population. We have high-speed rural roads, military presence. So we do have quite a few fatalities and hospitalizations due to brain injury. Okay, I'm going to hand it over to Judy now to talk about the impact brain injury has on our communities.
Great. So what I'm going to do is just talk a little bit more in depth about some of the special kind of populations and areas where we see brain injury and the issues related to brain injury that stand out and will likely stand out for you in terms of your communities. So brain injury itself just provides, unfortunately, a multitude of losses. It ranges from people's functional ability may change, their cognitive ability, but some of those other areas around life role changes in terms of being a worker, a spouse, a partner, breadwinner, all of those things. Social networks change significantly, often after brain injury. People's self-esteems kind of just take a hit related to this, and intimacy. And so then what we see is that the reason that we feel it's important to understand brain injury in your community is that it puts people at much greater risk for homelessness, substance abuse, criminal activity, and mental health issues. And we'll talk about each of those a little bit more specifically. In terms of behavioral health, so almost half of adults with TBI who had no pre-injury of behavioral health or mental health problems develop those issues following traumatic brain injury. So that's a really significant number if you think about the data that Liz shared. About a third of TBI survivors experience emotional problems, and some of those issues that they're reporting are feeling of hopelessness. So 35%, suicide ideation and suicidal attempts go up significantly following brain injury. It's their family members and support systems that are really noticing that that their loved one is experiencing some of these emotional and behavioral problems following brain injury. The person with the injury may lack that awareness themselves, but about 85% of survivors' families report emotional or behavioral problems following injury. I want to draw your attention to the last bullet here, which is related to suicide ideation. So what we know from research is that it's about 7% or 7 times higher in people with TBI than those without in terms of attempts and suicide ideation. I think the significant piece of this beyond that, which is significant, is that that risk for suicide persists up to 15 years post-injury. And that's something that we're just now beginning to understand based on research, that risk does not go away. It's not just a transitional issue, but it's maybe perhaps lifelong following brain injury. So if you think about some of the specific risks that I mentioned earlier, in terms of homelessness, we've done some work, and there's been some work done nationally, but there's approximately 43% of individuals who are homeless who report having sustained a traumatic brain injury. And that mean age of sustaining that first injury being the age of 15. And again, Liz had mentioned that the younger you are when you sustain your injury, it's true that we're more resilient when we're young. However, we do not have some of the skill sets that we do as we age. And so those young folks with brain injury are at risk of not being able to succeed in these kind of life independent living endeavors. The other issue around homelessness is that we see a higher diagnosis of mental health, substance abuse, suicidality or suicide ideation, victimization, and just greater difficulties with activities of daily living that go up with that. So you can just see that is a significant issue. And so if you have a population of folks who are homeless in your community, there's a very high likelihood that many of them have experienced a traumatic brain injury. Another particular area of concern that we've found is intimate partner violence. So we know that violence is one of the leading causes of brain injury in the United States. And in terms of intimate partner violence, there's been a few interesting studies as of late related to this, but some of the other studies report that 30% reported a loss of consciousness at least once, and 67 reported residual problems that were likely brain injury related. Again, that's a pretty significant number if you start to break that down. Another study, it was a smaller sample, but there were approximately 75% of those individuals who were surveyed that had experienced at least one partner-related brain injury, and then 50% sustaining multiple. That's not something that we touched on yet, but when we look at screening for brain injury, we're interested to know how many brain injuries, not just one brain injury that the person sustained, because there is an accumulative effect when someone's had multiple brain injuries, and the ability to recover from one uncomplicated mild brain injury is much better than if you've experienced several repeated blows to the head. So the example I'll give to you, intimate partner violence being a key example, but also we have our youth in sports. And so we've heard a lot with the NFL in terms of concussions and brain injury, and there's been new laws and protocols that have been put out as a result of some of that awareness. The other area that we see this significantly is in our veteran population. So those who have experienced combat, and especially the last conflicts that we were in terms of brain injury being the signature injury for those conflicts. So that's another thing to just kind of keep in mind, is that when people are exposed to repeated injury, the outcomes tend to be much worse. So in terms of youth as its own special population, Liz talked a bit about youth and some of the vulnerabilities of this population. But I think a lot of people are surprised to know that traumatic brain injury is the leading cause of death and disability among children ages 1 to 19 in the United States. Each year, about 40% of traumatic brain injuries in the U.S. occur in the pediatric population. And then the complicating issue with youth, and actually, kids grow up to be adults with brain injury, but one of the complicating issues around brain injury is a trauma history. And so we know that our kids in foster care and those in the child welfare system have had greater or at greater risk for trauma exposure. And when people experience trauma, even if it's not traumatic brain injury, it really reduces the effectiveness of the brain to recover. And so this is a particularly vulnerable population that we are aware of. Physical abuse is reported by about 48.4% of foster care youth and 64% of foster care youth who experience complex trauma. So you can kind of see that correlation, and again, might be a vulnerable population to really pay attention to in terms of brain injury. And Liz had mentioned that assault, otherwise known as shaken baby syndrome, is leading cause of brain injury in children 0 to 4. So to me, that's a call for really understanding how to prevent that and prevent brain injury, and working with families of young children to help them learn some coping skills so that we can reduce the amount of assaults that are occurring. The other issue around youth is that we see that children under the age of 1, followed by 1 to 4-year-olds, are the most likely to be treated in the emergency department for TBI. And again, that's something that, unfortunately, what happens then is that those injuries don't go reported. And so these youth are entering our schools. No one's really noting that they had a brain injury. And if they sustain a second brain injury or multiple brain injuries, they might have poorer outcomes. And then nobody's really making the connection to the fact that they had brain injury, and that might be part of why they're struggling in school. So then that cycle of failure continues. And it leads to some of those other issues we talked about before. Another vulnerable population for us in terms of brain injury is our aging population. We know that adults ages 75 and older have the highest rates of TBI-related hospitalizations and death. They recover more slowly and unfortunately die more often from their injuries than younger folks. 1 out of 3 adults aged 65 and older fall each year. But the problem that we experience with our aging adult population is they're less likely to talk to their healthcare providers about it. And there's fears for them about not being able to live independently and other issues that they're concerned about as to why they don't disclose this to their healthcare providers. And the other issue just kind of related to that is that oftentimes brain injury is not easily diagnosed in our aging population. It gets confused or misdiagnosed as maybe dementia or Alzheimer's, some early onset aging issues or concerns, versus it being a brain injury or concussion that they sustained. And then in terms of aging with a brain injury, so if you sustained your brain injury at a younger age, unfortunately, research is showing a link between the risk of developing Alzheimer's disease or dementia later in life if you sustain a brain injury. So the kind of long-term health picture of individuals with brain injury, what we see often is that there's a period where they're really gaining some momentum in terms of recovery, and that's usually within that first 1 to 2 years. Then they medically somewhat plateau. But then as we've been understanding brain injury better, it's a relatively new disability. We're seeing more studies that show that their health outcomes become poorer as they age. And so it's really a chronic health condition. Substance abuse and brain injury go hand in hand. It's kind of the old chicken or egg issue. So we know that intoxication can lead to sustaining a traumatic brain injury, whether it be through drinking and driving or just other risk behavior and falls, assaults, other issues that occur after intoxication. We also know that early life exposure to traumatic brain injury predisposes an individual to develop substance abuse. And then the third complicating factor here is that the structural damage from TBI changes that behavioral control, and therefore sometimes they're not as equipped to be able to handle alcohol or substances, and importantly, if they develop a substance abuse problem, to be able to effectively be treated for those issues. Another issue and this is something that we've spent the last 4 years really looking into, but there is a significant correlation between brain injury and criminal justice and being involved in criminal activity. And so there's been different studies, but one meta-analysis looked at a variety of studies and found that roughly 65% of inmates have reported having experienced a head injury or TBI. And just to put that in context, about 8.5% of our general population have reported brain injury. So it's significantly higher than in the general population. We also know that the correlation of brain injury and mental health problems is even higher in the prison or criminal justice population. In the study that we just did, it was approximately 87% of those who screened positive for traumatic brain injury also had a co-occurring behavioral health problem, whether that be mental illness or substance abuse type of behavioral health concern. And we talked about this briefly, but 60% of individuals in our work show that they've been victims of childhood violence, compared to 10% of the general population. We also know that among male prisoners, a history of TBI is strongly associated with perpetration of never mind, gonna skip that word, of domestic and other kinds of violence. So it kind of, brain injury begets violence, unfortunately, and it's partly what Liz was describing with the frontal lobe and that poor impulse control and judgment. So just kind of recap that, but 8.5% of the general population have experienced brain injury in our correctional settings, around 65%. In our study specifically, we looked at Denver juvenile probation, and it's around 22% have had a history of brain injury, and that's pretty much in line with national research. And then in our across our criminal justice settings in Colorado, 52%, and you can kind of see the numbers of which we screened. We screened 3,275, and 1,703 had a positive screening for traumatic brain injury. And I think importantly to understand is we want to know lifetime history of brain injury, but we also want to know, are they experiencing any kind of current impairment or difficulty? And the reason for any of this is to help kind of modify and adjust how we're working with an individual to help them be more successful in those settings. And so of our population, 73% screened positive for gross cognitive impairment. Just a couple more on criminal justice setting, because it is such a significant area. If you look at kind of our general population of folks with brain injury, so those with brain injury not involved in the criminal justice setting, what Liz said is very accurate, and that is that the majority of those folks have had a mild brain injury. So concussion or loss of consciousness up to 30 minutes, just to remind you of what mild brain injury stands for. And only 26% have moderate to severe. In a jail study done out of South Carolina, you can see that it was somewhat similar in terms of that breakdown from mild to moderate severe. In a study that we did at Denver County Jail, it was actually closer to 50-50. And so one of the misconceptions that we had when we went into some of this work is that we felt like, well, mostly it's going to be those who've had mild brain injury screening positive because they would not have had medical intervention and different things, and so it could have gone undiagnosed. But in reality, what we found is that a lot of folks at least in the Denver County Jail, and it kind of bears true throughout all of our settings, are dealing with a more moderate severe brain injury, more than we had anticipated. So Liz had mentioned the brain injury strategies video, and we'll just let you guys go to the Brain Injury Alliance of Colorado website, and that'll be referenced later in the presentation to take a look at this. But I recommend that if you are working with folks with brain injury or know folks in your community who have brain injury, this is just a very good overview of some basic strategies of how to address and support those individuals. One thing that the Brain Injury Alliance does, and I tend to partner with them on, is training for police officers around how to work with individuals with brain injury. We've done some training in terms of crisis response teams, because I think if you just have a general sense of what someone's struggling with in terms of brain injury, it often helps to de-escalate a situation pretty significantly. So we kind of want to leave you with basically what to do now that you are aware of brain injury and the impact brain injury can have. We want to leave you with what are some of the resources, services, and supports that are available to you in your communities. So just to give you a little bit more detail about my agency, MINDSOURCE Brain Injury Network, as was mentioned early on, we're housed at the Colorado Department of Human Services. What we're responsible for is the Department of Human Services was named the lead state agency on brain injury, and that was done through a governor's executive order in 2000. And basically what that allows me to do is really establish a strong partnership with our other state agencies and community partners to do training and technical assistance related to brain injury. And so I just put that out to you now that both Liz and I at the Brain Injury Alliance and MINDSOURCE were available to do any kind of training or technical assistance that you might want for your community. The other thing that we're responsible for is to develop initiatives to improve outcomes for special populations. I had mentioned the work that we have done in criminal justice, and that's just one example of a special population that we have noted a significant need related to. So we started developing interventions in a criminal justice setting to help improve those outcomes for those individuals. And then the last piece is that we administer the Traumatic Brain Injury Trust Fund. And so the trust fund, we collect surcharges from DUI, DWAI, and speeding convictions. And then in 2007, we added a children's helmet law in Colorado. Those surcharges go into the fund that we manage, and by statute, we're mandated to provide education around brain injury, research related to brain injury, and supports and services for individuals with brain injury. And so for the education component, we offer community grants. And so that's something that you all might be interested in. We've had community grants in several places across the state of Colorado. And some of those initiatives are related to how can we look at preventing brain injury in our community? So maybe helmet awareness. One thing that stands out is at the rodeo in Eastern Colorado, they did a helmet campaign and understanding and awareness campaign about brain injury. We do fall prevention across the state in partnership with the State Unit on Aging and the local areas on aging agencies to help people get out awareness and prevention around falls. We also do fun projects that look at how do you support and provide interventions for people who have brain injury in a variety of settings. It's one thing about brain injury, it's equal opportunity disabling condition, and it cuts across pretty much any entire environment that you can think of. Research grants are a competitive process that we award to universities and hospitals and other entities to study and understand better the care and treatment of brain injury. So we're unique in Colorado in that we have that, and it helps us stand out nationally in terms of leading the effort around research related to brain injury. And then interagency collaboration, I'll talk about the Colorado Department of Education as a specific example, and Liz will talk about supports and what that looks like. So Colorado Department of Education, basically our funds help to, well, we have 2 brain injury consultants at Department of Ed. Our funds help to support one of those consultants, and then Department of Ed supports the other consultant. And we've developed what's called brain step teams and concussion management teams, and I'll just kind of briefly touch on those. Brain Steps was developed a couple of years ago, and it was modeled after a really successful program in Pennsylvania called Brain Steps. And the idea around Brain Steps is to help develop teams of kind of experts within the school districts to help them understand how to work with students with brain injury, how to identify, how to support, and they become kind of that consulting team and experts within their own district. So we work both at a district and a BOCES level with these consultation teams. And in this term, brain injury is traumatic and non-traumatic injuries. So whether it be external cause to the injury or internal, and it's somewhat significant to point that out because for special education purposes, it has to be traumatic. But these school teams are designed to work with both. This is just a map that shows you kind of what areas of the state are covered by these brain injury teams so far. And again, this is a new initiative. It's only a couple of years old. We have 16 school districts that have Brain Steps teams and 4 BOCES with Brain Steps teams. And so if you're in an area where you see white space and you're interested in understanding this more and having someone talk to you about the idea of developing a Brain Steps team, you can contact us and I'll get you in touch with our brain injury consultants because our goal is to color in this map. The other initiative that we support through the Department of Education are concussion management teams. And so where the BrainSteps teams is more for moderate severe, this is for those students who have had a mild brain injury or concussion. And we're looking at a 4 to 6 week projected recovery period. So these are much quicker, more responsive in terms of trying to manage that concussion so it doesn't result in any ongoing concerns or issues. And if it does linger and go beyond the 4 to 6 weeks of recovery, then that student is referred to the BrainSteps team. So we have the continuum covered. And just to kind of highlight that a little bit more, concussion management teams are school building-based teams, where BrainSteps teams are district-based. And that's because of the need to be quick and responsive. So the school base is important for concussion. They're looking at 4 to 6 weeks of support, where the BrainSteps team is providing support ongoing through the child's recovery and throughout their career in school. The concussion management teams have a return to learn focus, and if the student does not recover fully and has lingering concerns, then they refer them to the BrainSteps team. I talked a fair amount about the criminal justice system, so I won't go into that much more, but there was a recent article in the Denver Post, so if you're interested in that, we can send you the link that highlights kind of the issues that we found in the work we did related to that. And I'm going to turn it back to Liz to talk about the Brain Injury Alliance of Colorado.
Thank you. So we are a statewide nonprofit. We've been around since the early 80s and have a number of programs and services to support people with brain injuries. Almost every state has a Brain Injury Alliance or Brain Injury Association that provides similar supports. So we are the go-to resource in our state. And obviously, as Judy mentioned, we contract with MINDSOURCE to deliver specific case management type services. Because of how the funding works, the majority of our services are free and of no cost to individuals participating. So for people, who are recently discharged from the hospital, for example, they would get connected with us through a variety of ways, and we would reach out, do an intake, try to understand what's going on in their life and how we can support them. Sometimes this is filling out applications, advocating for them at appointments with medical providers, helping them find appropriate medical providers. We do a lot of in-house services like classes and workshops. There are almost 70 support groups across the state for people with brain injuries, several online. A lot of times that support is geared towards people that surround that individual with brain injuries. So spouses, family members, caregivers, things like that. As Judy mentioned, we also do training and consultation to community providers, so domestic violence shelters or mental health centers or homeless shelters, police, all kinds of individuals in the community that might be interacting with people with brain injuries, and helping them identify those individuals and better support them, and then help them get connected with us and our services. We do an annual conference in November this year. It'll be in the Denver area. We have a number of recreation programs. We can provide utility assistance to individuals whose energy is about to be shut off or is already shut off. That's through a program with Energy Outreach Colorado. And then we're a member of the United States Brain Injury Alliance. So, for example, there are a number of people who come here to ski and get into an accident and sustain a brain injury and eventually need to return to whatever state they came from, and we can help kind of hand them off to their home state. I mentioned these briefly, but we do classes and workshops all over the state and of varying topics. Sometimes they're educational around things like financial health or just better understanding their brain injury. And then sometimes they're more therapeutic or recreational. We have like a 6-week cooking class that helps people kind of practice some of those skills and learn more about nutrition after brain injury. music therapy, art therapy, adaptive yoga. And like I said, these are all over the state. These are free, and they just have to register and sign up. We do have some recreation programs. These have a cost, but we do golf tournaments throughout the year to offset those costs for people. But some of them are multi-day opportunities up in Breckenridge all throughout the year. So in the summer, it's canoeing and ropes courses. In the winter, it's adaptive skiing, snowshoeing, things like that. We also do one-day programs such as rock climbing, paddle sports, and then we've been doing a lot more social activities, movies, film festivals, theater productions. As Judy mentioned before, isolation can be huge with this population, depression, anxiety, and so we're really trying to build more comprehensive and robust services for individuals that we work with. Last fiscal year, through all of our different activities, we served over 1,000 individuals in different programs. I mentioned this before. There's a map on our website, so if you are in any of the different regions, you can kind of narrow down where different support groups are, and we also help people navigate which support groups are appropriate for them. This is a really great tool on our website. It's our online resource directory. This is how we help connect people with different services and resources. We have over 800 entries in here. So, we try to be pretty specific about who's in here. It's not lens crafters, like it's, a vision therapist in Golden that's worked with individuals with brain injury before and understands their needs. So we help people get connected to resources like that. Judy mentioned the online video before. We also have kind of a 101 that provides just an overview of kind of what we talked about at the beginning of this, like what is a brain injury, who in Colorado is sustaining brain injuries, how does it affect them? We have a 102 that's more about strategies and accommodations. Both of these videos are under 5 minutes, and we have a third one coming out this summer that's specific to youth in the classroom. That'll be helpful for parents and teachers. Obviously, we can come and do trainings in person, but for people looking for a refresher or just a quick overview, these are really helpful. A ton of other links on this page, on our Education for Professionals page, with webinars and best practices, things like that. We also do a newsletter. We have a printed copy that goes to clients that are in services with us, but if you're interested in the electronic copy, we can add you to our email list, and that's comes out every 3 to 4 months. We really try to provide information about like tangible content as opposed to, hey, we have a fundraising event coming up. So more applicable, meaningful information in here. Okay.
So just to kind of wrap up the webinar, we wanted to just chat about what we're looking ahead and what we're thinking about, but a big focus that we have in partnership with the Brain Injury Alliance is to improve identification of brain injury within systems. I mentioned that brain injury cuts across all systems. And so as I'm talking through this, I encourage you to think about how this could interplay with your communities, and if you would like any support from us in terms of helping to set up some systems and protocol related to any of these or training, we are very happy to do that. And so we've worked in a lot of different communities in terms of improving identification. If you don't know someone has a brain injury, you can't support the person with the brain injury. So it's important to have some of those in place. And then the main thing that we're really working to do is link people to services and supports. We don't want to just screen and identify for the purpose of numbers. We want to really get people connected to those long-term supports that they might need. We're happy to do education, as Liz had mentioned and I mentioned previously. So if you have educational needs or want us to chat with you about what we can provide, we're happy to do that. And then lastly, I mentioned the Colorado Traumatic Brain Injury Trust Fund, and part of that is that we collect surcharges. Some of those surcharges are state-oriented surcharges, and others are municipal. And so we would love to partner with your municipality to talk about how we can increase statewide surcharge collection, and what that might mean for your community in terms of access to services and support for individuals in your communities who have brain injury. And so our contact information is both in the beginning of this presentation and also right here at the end of the presentation. So we definitely encourage you to reach out to us, and we would love to partner with you in your local communities and help identify and support any of the needs that you have. Thank you for your time.
Great. Thank you so much. What wonderful information. At this time, if you have any questions, feel free to type them into the question box on your toolbar there, and I'll give you a minute to do that. In the meantime, just want to thank our presenters again. Really appreciate you being here. We are recording it. We will put it on the website. It'll probably be up there by tomorrow. So just have a look under cml.org under training materials, and you'll see this link that you can then share with others or refer back to yourself. All right. Well, I'll give it another 30 seconds, folks, if you have any questions. And you can always reach out to our presenters directly. Their email addresses are right there, and they would be happy to help out and talk about specifics within your communities and how they could offer some support. All right, well, seeing no questions, we will adjourn. Thank you all so much. Thank you to our presenters. We really appreciate you being here, both Judy and Liz. And I hope everyone has a fantastic rest of your day.